So the second part that we're going to talk about, and yeah, for those of you that joined, we are going to do this in 3 parts. We're busy starting with part 2 now, and at 6 o'clock, there will be a survey for possible CPD ethics points, which I'm about 95% sure we're going to get. Now in part 2, we're going to be talking about sexual rights. And remember, we've now looked at sexual pleasure. And what's interesting is that if you look at this diversity, and this diversity has always been there, that's not new. It's been there since time, since human beings have been human beings. But sexual rights is a new concept saying that we're allowed to actually have this whole range of different experiences about sexual pleasure, where 150 or 200 years ago, there was very clear rules about what was allowed and what was not allowed. And of course, in the global world of today, there's huge inequality in terms of what sexual pleasure is allowed and what's not allowed. So this is the sexual rights definition. And I just want to highlight this little bottom bit. This is from the WHO, updated 2010. So sexual rights protect all people's rights to fulfill and express their sexuality and enjoy sexual health, with due regard for the rights of others and within a framework of protection against discrimination. And I think we all want that. So certainly for ourselves. So whatever your sexual particular pleasure is all about, you want the right to be able to experience that within your relationships or within yourself. And these rights has not been an on-off button. And as I've said, it's globally very different. And things have changed progressively over the last 100 years and is still changing. So just to remind us about some of the major milestones. So the big thing, of course, was women's sexual rights, was the first big revolution in the world of sexual rights. And look, it was only by 1974 that most states in the USA actually allowed a 17 or an 18-year-old to access the pill without parental consent. So just women's ability to control their own reproductive health is still a relatively recent development. And then, of course, in South Africa, we have to mention the horror of actually having rights issues in terms of race and sexual relationships with the Prohibition of Mixed Marriages Act. And just note that that was only repealed in 1985. So those are rights that we now take absolutely for granted and which our children take absolutely for granted, but those are rights we really had to fight for. And then, of course, a huge area of sexual rights also in South Africa has been around HIV. Over the last 20, 30 years, we've had a massive work in terms of looking at how to promote best sexual health, sexual services for patients, both in prevention of HIV and looking after patients with HIV. And a lot of that has been rights battles, and not only in South Africa, but all across the world. And you can see this is our latest document. This is an ongoing process about providing for HIV and also specifically for key populations that are being left behind. And then the other big thing in the last 20 years is around the sexual rights of our LGBTIQA+. For those of you who are a little bit out of date with the, so that, by the way, is the updated pride flag. I noticed that my daughter's grade 11, and they are very, they know, yeah, this is the language of our youth today. They talk about gender diversity in all kinds of different aspects. They're very comfortable with these abbreviations. For you, those of you that are a bit older, it might all seem a little bit distant. So just a reminder, our lesbian, gay, bisexual, transgender, intersex, queer, asexual, and plus. So it just shows how, as we are looking at sexual diversity, we are expanding the definitions of what that means. And what's been quite exciting as people have been looking at what sexual pleasure means, we have discovered there are a myriad different ways of experiencing yourself and experiencing sex and experiencing relationships. And there's actually so many different words now to try and describe all those different experiences. So here in the bottom is actually our latest and very large survey that was done in South Africa to look at prevalence, specifically just of LGBT. So not looking at the wider, there's a lot of people who gender express themselves, for example, quite neutrally or gender fluidly. But in terms of the world of LGBT, people identifying either as lesbian, gay, bisexual, or transgender, you can see overall in our population, it's about 1.4% of our population, which is a substantial part of our residents. I'm just seeing my connection is unstable. I hope you're still with me. And you can see it's about 1.2% in men and about 1.6% in women, and there's the confidence intervals next to it. So in terms of sexual orientation and rights, very exciting, of course, South Africa's constitution was the first in the world to prohibit unfair discrimination on the grounds of sexual orientation. We were ahead of the world. We're probably ahead of a lot of our citizens in our country as well. But we put that in there. And I think sometimes in South Africa, we forget how the rest of the world is not necessarily there. There's been a progressive realization of rights across the world, but there are still countries, all of the ones here highlighted in red, published by the Human Dignity Trust, shows us all the countries where LGBT activities are still criminalized in one form or another. And of course, the most frightening thing is that there are still countries who have death sentences for LGBT behavior. So, for example, Nigeria, Saudi Arabia, Yemen, Pakistan, etc. And some of those are actually death by stoning. So when we're talking about sexual rights, even just living in one country next to another, things can already be very different in terms of what sexual pleasure is allowed and what is not. And of course, wider than just pleasure. So this is this data is from this amazing study, and I like this the name when they published this study. It was done by the Human Sciences Research Council. They called it Progressive Prudes. They were looking at South African attitudes towards homosexuality. And what I'm just going to highlight a couple of numbers here. The big one here is on the right, that 51% of all South Africans believe that gay people should have the same human rights as all other citizens. So that's just over 50%. But even though 72% feel that same-sex sexual activity is morally wrong. So we have this amazing might be the wrong word, but this incredible phenomenon in South Africa where people are able to embrace other people even when it's not necessarily when it's not their own beliefs or their own ideas. So this is something in South Africa that we can do quite well. We can say, well, I think it's morally wrong, but I still think that their rights should be protected. And that does not happen in every country. And it's also changing. So for example, in 2012, again, you're on the right, only one out of there's been a 10-fold increase in people feeling comfortable or thinking that same-sex marriages should be allowed. And so we can see that, especially when we look at the young people growing up today, this conflict between personal ideas or beliefs and our ability to respect others is becoming easier and easier. Our young people find it easy to navigate that conflict. So we just talked about sexual orientation. I'm going to have a couple of slides on gender diversity because there's been some exciting developments in terms of the rights around gender diversity. And here we might need to update on terminology, right? So at the WAS conference, there's a lot that's been happening in the last year, and they've just brought out a statement concerning actions to support gender diversity worldwide. I'm just going to highlight the bottom bit out of that statement there. So recognizes that persons' sexual orientations, gender identities, gender expressions, and bodily diversities require human rights protection. So if we go through that as a way to start looking at how do we create global acceptance of gender diversity, and WAS is looking for people to actually contribute to that statement. So just to remember that sexual orientation, so that's who you're attracted to, whether it's same sex or opposite sex, or there's lots of different varieties on that. I'm not going to go into that. Is different than gender identity, which is how you identify or which gender you identify with. So some of our terminologies that you might come across when you're reading documents around transgender is the birth you were, the gender you were assigned at birth, so assigned male at birth or assigned female at birth. In some of the documents like the DSM, they talk about natally male or natally female. And then when we talk about transgender people, we mean people who have a gender identity that is different than their sex assigned at birth. So a transgender woman would have been assigned male at birth, but expresses and identifies as a woman. And a transgender man would have been assigned female at birth, but identifies with being a man. Cisgender is the term that we use for those that are not transgender. So if you were born female, assigned female at birth, and you identify as a female, you would be considered cisgender. And then a term that is certainly growing and is also very much our young people are very comfortable in talking about non-binary or genderqueer or gender fluid. And it's referring to people whose gender does not fall within those binary categories of man and woman. I'm just showing you this website, so please go and look up the genderbread person, but I'm going to look at the Wits RHI version of this. And I love the genderbread man, or in this case called gender Jabu, as this is a very nice way to have conversation. So if you are in sexual health services and you want to have a conversation with somebody in a nice neutral way about where they're at in terms of their sexuality, you can use this. It's a lovely way to talk to teenagers. If you've got your own kids you want to talk to, or if you do sex education, for them to start becoming aware of these different terminologies. So gender identity, we mentioned that earlier. So who do you identify with in terms of a male or female? Gender expression is how you express yourself into the outer world. So what kind of, do you wear more feminine, more masculine, more neutral, other? There's a sex that you were assigned at birth. So other genders, for example, might refer to intersex. And then they've got these two that you can actually look at if you're physically attracted to or emotionally attracted to. So yeah, we can also think in terms of the terms. So for me, physically attracted quite often talks about sexually desire, and emotional attraction quite often talks about sensual desire or nurturance, as we spoke about it earlier. But of course, you can see these concepts is very fluid and very interchangeable, but you can start having a conversation about different types of desire, such as sexual desire versus sensual desire, being physically attracted or emotionally attracted. And of course, one can put in here as well, spontaneous desire versus responsive desire, like we talked about earlier. So each of us, it's got a whole mix of all these different ways. And what's wonderful about this, of course, it can change and it can shift. And it depends on what age you are or who you're with, or the situations you find yourself in. And your patients can also be different at different times. So this is always a nice poster to have up in your sexual health clinic. So we talked a bit about gender diversity. I just want to mention adolescent health. So that's the other big rights issue. And it was interesting listening to the talks at WAS 2021, because of course in India, there's a huge issue with girls being married and having to have a first child before the age of 18, arranged marriages in which they don't have much say. So there's a lot of work being done around that. Sexual health and disability, and being able to make sure that we don't infringe on the rights of disabled people and their sexual health. Sexual configuration is also something that was one of the themes at WAS 2021. So concepts around consensual, sexual non-monogamy and polyamorous relationships. So how people choose to have relationships, and all of it obviously consensual. And then sex workers, one of my passionate topics, which we won't discuss today in detail, but also our challenges is we can't provide services for sex workers if the work is still criminalized. And so looking at, can we decriminalize sex workers so that we can actually provide proper sexual health services and the rights of those workers.